the door and come back.
a 63-year-old lady who visited
Come
at
back.
Gurgaon
Come
Knee
back.
and Shoulder Clinic for treatment of her knee problem. As you can see, she has bowing of both
That's
legs because of severe osteoarthritis in both knees. She underwent a bilateral knee replacement surgery in the same sitting. She recovered well from her surgery, and as you can see, she is now 10 days after her procedure, quite comfortably bending and straightening her legs. And as you can see, when she stands, the deformities seen her knees are also completely corrected. She's now 2 weeks after her surgery and is able to walk quite comfortably without using any support and is ready to fly back home.
go back.
Ora, oh così, vedi che vuole che le... Mi sono che faccio male. Oh, vuole... Non sai, ma io faccio. Oh, vuole... Oh, no, sto qui. No, non
Come
vuole
back.
dire. Oh, vuole dire. Vuole dire.
This gentleman from
Yeah. Come
Nigeria
and take a few
presented
steps
to
from here to there.
Gurgaon Knee and Shoulder Clinic with extremely bad deformed right knee.
That's
As you can
okay.
see, he's barely able to walk even a few steps without using a support. His knee was badly damaged, and the X-rays and CT scan showed severe loss of bone structure and bony support. This gentleman required a special uh, type of knee replacement surgery which corrected his knee deformity and restored the movements. This is the x-rays after surgery. And as you can see, following surgery, his leg is now straight, the deformity is corrected, and this gentleman has now started walking independently on the third day post surgery. He would be using this frame for few weeks before walking independently.
That's okay. You can turn around and come back.
Elizabeth visited us from Tanzania. She underwent a left knee replacement surgery and she's now on her second post surgery day, walking quite comfortably within her room. We use a special technique called MIS knee surgery, which involves a very small incision to carry out the operation. The main advantages of this minimally invasive surgical technique is that the incision is small, it doesn't involve any blood transfusion, and patients are able to recover very, very fast as compared to a standard surgical procedure. Henrietta presented to us with a very challenging situation. She had been on a wheelchair for 2 years before coming to Gurgaon Knee and Shoulder Clinic. She had been operated upon her right knee at Nigeria. The surgery had failed and that left her right knee floppy and she was unable to bear any weight on her right leg. She also suffered from a bad arthritis in the left knee. The x-rays of the right leg showed uh, broken implants with screws and metalwork with a failed fracture above the knee joint. The x-rays of left knee showed severe arthritis with hundreds of loose bodies. And this is a rare condition called synovial chondromatosis, which damages the knee joint. Her right knee needed a special custom-made implant which not only replaced the knee joint but also replaced the lower half of the thigh bone. And she underwent a standard knee replacement on the left side. In surgery, she was able to resume independent walking, and when I met her in Nigeria a year ago, she was doing
That's very
wonderfully
good.
well, doing
Perfect. You can
all
turn around
activities
and go
of
back to your
daily
bed.
living, including dancing.
This one, this one, this one. Nice.
This model, yeah.
Yeah.
When I came into the hospital, Dr. Jayant took care, gave me some medications, he tested all my body system, my blood group, everything, and found out it was fine. And eventually there was placed that the operation be taken up in a day or two. And they've been so nice, both the nurses, they all cooperated. They all cooperated very well, and the operation went on fine. So happy, very happy and alive again.
Okay.
And I encourage everybody to come to Columbia Asian Hospital for a good knee replacement. And your life will never be the same again.
Thank you.